The whiny woman: how a dismissive medical term affects women's health care. In the world of medicine, diagnoses are supposed to be accurate and based on scientific evidence. But what happens when a patient's complaints are ignored and dismissed as mere psychological symptoms? This is the question posed by Dr. Mary Claire Haver, who reveals how a derogatory term influenced her career and continues to be used in various medical fields. Dr. Haver recalls a case involving a patient in her 40s who was suffering from a variety of overlapping symptoms: irregular periods, insomnia, weight gain, and headaches. These symptoms, which had led the patient to see multiple doctors without success, were dismissed by Dr. Haver's superior. He labeled her a WW, short for whiny woman, and specified that since she was Caucasian, she was a WWW, a whiny white woman. According to Dr. Haver, this term, which may seem like a cruel joke, is actually part of a systematic lore widespread in the medical community. Under different names like Whiny Ginies in California or Madame Dolores in other areas, this concept is used to categorize women in their 30s and 40s who have multiple complaints that can't be explained by lab work. Instead of looking for a real explanation for their symptoms, doctors are led to believe that these women tend to somaticize psychological problems, and that their symptoms are nothing more than imagined. What's particularly troubling about this approach, as Dr. Haver explains, is that doctors were never taught that hormones could be responsible for these symptoms. This systemic disregard for hormones as a potential cause of health issues has created a medical culture that says if a diagnosis isn't obvious, then it's all in her head. Ultimately, this story highlights a much deeper issue than just a dismissive term. It exposes a gap in medical education and a culture that allows for the suffering of women to be overlooked. Dr. Haver's story serves as a wake-up call to both doctors and patients, urging them to question why certain symptoms are dismissed and to search for real answers instead of accepting biased classifications.